Hello, my name's Amy. My presentation is on autism symptoms and treatment. Autism is a developmental disorder that causes social, cognitive, communicative impairments as well as repetitive behavior. If autism is diagnosed early and treatment is started, the child is more likely to develop better social skills. It is now known that children with autism do express emotions and have a need for emotional and social relationships. Understanding autism and implementing treatments will lead to fewer of these deficits. While the causes of autism are unclear, there is a strong genetic component to autism. This is seen in the 80 to 90% concordance rates among monozygotic twins. Abnormalities with neurotransmitters, specifically dopamine, serotonin, and GABA, may play a role in the development of autism and cause deficits in motor performance. Autism develops in childhood and creates obstacles in daily activities. Autism causes impairments in communication, social behavior, and repetitive behavior. There are also symptoms of autism called associated symptoms, such as motor impairments and problems expressing emotions. Autism is defined by the symptoms of social and communication deficits and repetitive behavior. Children with autism have poor social skills and have problems interacting with their peers. Social skill deficits make it harder for children with autism to establish friendships and may lead to behavioral problems. Communication deficits are the most obvious symptom of autism. Whitehouse et al. Found that there is no specific language impairment subtype in autism, but that the deficits are related to the core symptoms of autism. Verbal skills have been shown to improve over time if the child is diagnosed at an early age. Language deficits may be explained by the comorbidity between autism and mental retardation. Children with autism often engage in repetitive behaviors. During play, children have exhibited repeated patterns of interaction with little variation, such as making the same motion with a toy, playing with the same thing, doing the same types of things over and over. This repetitive behavior causes an opposition to change in behavioral patterns, obsessions, and compulsions. Motor impairment is considered as an associated symptom of autism, and although Ming et al. Studied a variety of motor impairments, they found that hypotonia, reduced muscle tension, and apraxia, deficits in fine motor movements, were the two main motor impairments. The fact that these impairments were not seen as often in older children led the researchers to deduce that these symptoms may improve throughout development. Individuals with autism have difficulty expressing emotion. However, they do desire to have emotional connections with others. Instead of describing a personal account of their emotional experience, they are more likely to give a description. Walsh and Katz found that it was easier for children with autism to express simple emotions such as happy or sad than it was to express complex emotions such as shame, guilt, or embarrassment. One of the main differences found in gender with autism was that females had more social and attention deficits than males. These differences could be caused by socialization, role models, and parental influence. Parents could possibly add to the problem by expecting daughters to be more social than sons and putting more pressure on them in that way. Social skills impairments affect children's ability to form friendships and may lead to behavioral problems. A social skills intervention for children with autism used pre-teaching, prompting, praise, and rewards at an elementary school. These procedures were relatively simple to implement and increased social attention and initiations among the children. Intensive behavioral treatment has been successful in improving behavior in preschool age children. Using pivotal response training, they tried to improve language in children from a previous study labeled responders and non-responders. The children labeled responders were the ones who were responded to the treatment or responded to conversation, and the non-responders in the previous treatment, they didn't have any response, didn't communicate. They found that the responder group improved in the area of play, social skills, and language. They concluded that one type of treatment does not work for all children, and that treatment needs to be matched to each child. In conclusion, more research needs to be done on autism in order to identify variations in symptoms and treatments. Identifying the causes of autism is important to understanding it better and producing more effective treatments. Involving teachers and parents in treatment programs would increase the effectiveness of the treatment and help the children with autism to establish social and emotional connections with others.